Hi, so as a physiotherapist, you might have to come across in situations where you would have to perform a proper diagnosis of certain patients, and in performing those diagnoses, you have to understand the proper history. You are going to, have to have a complete assessment of the patient. And while going through the assessment process, you're going to ask about the patient's history. In the history, you will learn about the kind of pain that the patient is probably having. So the pain is situated with the current illness or the problem that the patient has. So in that situation, the often difficult part is that the person is unable to understand what kind of pain is it. So today we are just going to understand what kind of pain the patient is having to perform a thorough and proper diagnosis as a physiotherapist. So there are different kinds of pain when you're trying to understand and listen to the patient. First of all, there can be a severe pain, or you have to know that there are different types. It can be severe, it can be irritable, it can be acute, or it can be a chronic pain. A severe pain is something if the pain doesn't let you move. So you have to see if the patient is unable to move, or he cannot perform any activity because of the severe or intense pain he's suffering from, then that is actually a severe form of pain. But there is another form that is often called as irritable pain. If you see that the pain is starting to increase, the more he moves, the more he is trying to do his activity, and this causes the pain to further increase, then that pain is called an irritable pain. Another pain is called an acute pain or a chronic pain. An acute pain is sharp, it is very intense, and you have to know that that pain is often associated with the patient's anxiety. Why? Because a person is often anxious because of that pain, or he's often associated with that. So a chronic pain is something else that is more often long term, and it can be very, very frustrating. Why? Because the patient is going through that pain for a very long period of time, and if a pain is so for such a long amount of time, it can often because the patient can suffer through a severe form of depression, and that pain can become more and more chronic. Okay, so most people know how to manage this, as because they've been suffering for it from such a long time. They know how to manage their chronic pain. Okay, so after that, you have to know how that pain is spreading through the body. Okay, so there are certain situations that you have to certain terms that you have to understand, where you will often come across with. One of these is primary hyperalgesia, and another is secondary hyperalgesia. Primary hyperalgesia is something that pain stays at the injury site. It if a patient says that he is having that pain, the pain is mostly localized. So we say that this is the peripheral sensitization of the nociceptors. Another pain form, how does the pain is spreading, is secondary hyperalgesia, that the pain spreads. It goes to the area other than the injured site. Okay, so this is what we call, why does this happen? It's because the brain or the spinal cord, they become extra sensitive to the part. The injured area is become so sensitive that it starts to having pain on the site other than the place where the area was injured in the first place. So this is often referred to as the central sensitization. Now, another thing that you often have heard about is a referred pain. What do you call a referred pain? A referred pain is because the pain shows up in a spot different than the actual injury. So it is very simple. Why does this happen? Because the nerves, they often get a mixed signals. So nerves getting mixed signals, they often associate with the pain that it is transferring to somewhere else. It is moving to somewhere else. So because of that, you associate that this pain is kind of a referred pain, because the pain is not having at the actual injury, it is having somewhere else. Okay, another point you will see and come across with are the trigger points. You have to learn the trigger points, the patient that is describing those trigger points. Now, what are those trigger points? They make this diagnosis very difficult. Why? Because trigger points are often very tight knots, muscles. Inside the muscles, there are tight knots that hurt when they are pressed. So whenever you press a certain point in a patient's body, in a certain tissue or in a muscle, that part is going to hurt other than the area, because a patient starts to feel a certain headache because of that, because trigger points often refer pain to other areas. Okay, So this often makes the diagnosis even more difficult than when it was supposed to be. I hope this makes things slightly clear for you. I hope this helps. Thank you.